The news that former President Joe Biden has stage 4 prostate cancer that has spread to his bones has some asking whether it could have been diagnosed sooner.
I talked today with Dr. Dana Rathkopf, a medical oncologist at New York's Memorial Sloan Kettering Cancer Center. She specializes in prostate cancer.
I see prostate cancer almost exclusively. It doesn't follow any one pattern.
Does it surprise you that it is so advanced and moving so quickly, given that he has seen the best doctors possible?
Cancer cells are chaotic, and they don't read the guideline rule books. And so our screening guidelines don't necessarily apply to a cancer cell that's going to decide to grow or evade a particular screening technique. And so, there are many people that have the, access to highest levels of care and undergo regular screening and still get diagnosed with advanced disease.
Given what he has been diagnosed as having, how long would he have had cancer, do you think, before this diagnosis?
Well, I can't really speak to the specifics of President Biden, but I would say that in general, advanced prostate cancer presents in many different ways. It's not really one size fits all.
It's stage 4 and in the bones. That didn't start just yesterday.
Typically, a more aggressive prostate cancer portends a worse prognosis, meaning that patients are at higher risk of having cancer grow quickly and or having cancer spread outside of the prostate. And when cancer spreads outside of the prostate to other parts of the body, we consider that metastatic. And so the most common place for prostate cancer to metastasize to is, in fact, the bone.
So if you were presented with a person with this case, you wouldn't say, oh, they missed it.
No, I would not say that.
And so, John, for men over 70 watching this, wondering, how does this apply to them? What's the doctor have to say about that?
The doctor said she's been getting calls the minute the news broke. First, her point is don't generalize from a single case. If you are concerned about this, talk to your doctor. She talked about shared decision making. And she said it's not necessarily the case if you're over 70 that you get a PSA test or a prostate test, because in some cases there can be false positives or the treatment can be worse than living a life with a cancer that's going to be very slow going, and it may outlive you. So basically, she said, talk to your doctor.
Solid advice. Yes. All right. Thanks, John.